Okay, hello everyone. Welcome to today's webinar, The Future of Consumer Reviews for Healthcare Organizations. So I am joined in the studio today by Paul Fahey. Hi,
And I'm
Paul.
and I'm Paul Fahey. Hi, Katie. Thanks for welcoming me.
So we'll be having our presentation popping up in just a moment. And if you're joining us on Zoom, welcome. And we are also streaming live to social media. If you're watching this after the fact, hello, thank you for joining us. So if you have any questions, please feel free to post them in the chat if you're on Zoom, or in the comments if you're on social. And if you're watching after the fact, feel free to email us or leave a comment and we will follow up with you soon. So I'm going to introduce our authors, the people who work on all of our content here at Smith & Jones. So we have Lisa Barone, who is our VP of Brand, does amazing content work. And of course, Paul Fahey, our Vice President, who you know.
And joining us live in the studio is Katie Source, our content strategist. Katie is responsible for all those conversations that we do and help our clients with, whether it's in social media platforms, email marketing, video, or in this case, online reviews. So thanks, Katie.
Yeah. So now we're going to kick it off with the agenda.
So what are we going to talk about today? Yes, online reviews for your hospital and health system. Yes, really? You betcha. Does it really matter? That depends. We'll talk about it. And how do I manage those reviews? There's a range of options and responses, from the never say no comment to suing your patients. We'll talk about all of those as we go through. Should be an interesting conversation. As Katie mentioned, the authors of today's webinar also contribute to a lot of our content. And we at Smith & Jones believe in putting it all out there. We want to share this with our clients and prospects, friends, the whole industry. It's part of the reason we publish our annual trends report, which you'll see on screen, and also our second edition of Under the Influence, which just was debuted both in print and audiobook form at the beginning of this year. So pretty exciting. All that's based on work we've been doing, all of us, actually. Smith & Jones has been around since '93. Almost as long as Murphy Brown, Katie. We'll get into that in a second. And it's really our collective experiences, work we've done on behalf of other clients. We do a lot of email surveys, our own work moderating hundreds and hundreds of focus groups. We are big fans of the American Hospital Association's content that they put out, and a lot of other tools, social listening tools, Google Trends. All of that helps to inform the attitudes and opinions and our thoughts that we'll share with you today and on all these other platforms. So let's begin. I think before we get into the online platforms themselves and the real nuts and bolts of what is it, how does it work, how do I manage it, I think it's important first to understand how patients make decisions. In particular, what influences them. And to our earlier point, it really depends on a number of different factors. So first, let's look at this, and I want to spend a moment on this. Consumer dependence in all categories on the opinions of others. So when it comes to different purchasing decisions, how influential are the opinions of others? So on the left side of your screen, there are products that are habitual purchases. They're commodities, milk, many of the groceries. Those are very low dependence upon the opinions of others. I don't know of anyone, and please, if you're out there and you can find something, put it in the chats, the comments. But if there's a Yelp or a place to complain about or ask about the best milk in your area, I want to know about it. But moving along that spectrum, slightly more opinion of others regarding luxury products, Louis Vuitton bags, for instance. There, your decisions are driven largely by emotion, more so than the utility. Do I need a handbag? Perhaps. Do I need, I call it a pocketbook also. Should I? I shouldn't call it a pocketbook.
I think those are different things.
My daughter makes fun of me all the time. So do I need the utility of a handbag? Sure. Do I need a Louis Vuitton handbag? Now you're into an emotional decision. And that's not always necessarily driven by the opinions of others, though it may be driven by the patterns of others. I see other people with this. I want one for myself. Now, chain restaurants, that's a consistent, in most cases, a very consistent experience. And it is less reliant on reviews, though reviews might matter to steer you for or away from a particular place. But generally, people know what to expect. And I don't necessarily ask or care about the Chick-fil-A sandwich at this particular location compared to all the others. Although Lisa Brown, our colleague, had shared with us, and we should drop this in the chat or email this out to folks, there is a website about whether or not the shake machines are working at a particular restaurant chain. I forgot what it is.
McDonald's.
Was it McDonald's? Yeah, and I think it was around Shamrock Shake season. So moving into slightly higher dependence upon the opinions of others. A non-luxury automobile, my first Honda Civic. Certainly people will start to do extensive research, or they will rely on the brand a bit for perceptions of quality and the confidence to make a decision. I may do research on reliability, cost of ownership and operation, because it's a higher level, higher dollar purchase. Things like independent restaurants, consumers will start to pay more attention now to the reviews of food critics. Here we're getting into those. And when it comes to things like electronic products, early adopter reviews, how well does it perform? Again, these are higher purchase. There's a little bit more at stake in some of these things in automobiles versus necessarily a restaurant meal. But here, I think people are much more dependent upon the opinions of others, looking at, does this next generation of iPad truly have a better screen? Does it do what I want? Is it better, faster, whatever else it is? So where does healthcare fit into this mix? Well, it's a jumbled sort of mix, as you can imagine. The decisions about what to do and where to do it sometimes are driven by just the acute nature of a particular patient. You may be brought in by EMS and not even conscious, so you're going where you're sent. But in a lot of cases, healthcare decisions where consumers do have choices or feel empowered to make those choices, and we'll talk about that in a minute. A lot of times it's driven by emotion. I'm off balance, I'm sick, I'm scared. I'm worried about what's happening, or I want the best care for myself or my family. Those are very emotional drivers. Now, there's certainly a utility to the services that hospitals and health systems provide, of course. You perform a service, and that is aimed at getting people better and back to their lives. But certainly brand, and you've heard us talk about this on a number of other webinars, brand matters, and that helps to form the basis of opinion and may even drive the opinions of others. And again, this is, I think, important foundational content as we start to move into why online reviews matter. Thank you. So consumer purchase decisions ultimately are affected by a combination of, say, three things. First, their personal preferences, beliefs, experiences, and emotion. All of that is rolled up into just their personal opinions. That's also influenced by people like ourselves and many of the people that are watching, marketers, the information that they provide. But very largely, and depending on the nature of the service line or what we're specifically talking about, the opinions of other people. Those are ultimately, whether it's direct experience or perhaps my own personal beliefs, information from marketers and information from other people. So let's break that down a little bit on the next few slides, and we'll also get into some of the generational differences that are covered in Chapter 2 of our book, which I think if you're all registered, you either have. I know I saw some familiar names on the attendee list today, so you already have. But for those of you that don't, you get a free copy. It's on its way to you. So anyway, as we go through, that first of those three different thoughts, preferences, beliefs, and experiences. Again, it's that direct experience that I may have had with an institution that forms my own decisions or helps me influence the decisions of others. I may have religious beliefs, whether I choose or how I choose to get my health care from what type of organization. I may prefer a faith-based organization compared to something else. And then those insights, reputation, outcomes, bedside manner, timeliness of getting, access to services, where my insurance allows me to go. All of those things come up first and foremost in all the focus groups we do. It's funny, as we go through those, I always have to probe, but wait a minute, what about the latest technology and the best doctors? It almost seems that that's the cost of doing business. These other areas of customer service, and you've heard us talk about that before, seem to matter a lot. And that's typically the topic of conversation, not only on social media platforms, but online reviews as well. It tends to be the things at the beginning of those lists rather than the end of those lists. I don't think I've ever seen any client that had to deal with somebody saying the latest robotic, the latest robot or MRI just isn't, it's a year or two old. I can't believe they're still using that.
Yeah, I totally agree with that. Like if you're in a rural area, I imagine it might be a little different, but if you're in like a metropolitan area, you're going to expect that everywhere has the latest technology and that they're all going to be comparable. So you're more looking for, okay, what have people said about the doctors, the experience. So yeah, I totally agree.
Yeah, and not only given the size of the institution, Katie, but also how much choice you have in a rural setting. To your
Mhm.
point, you may not have a lot of
Mhm.
choices that are even convenient, but in a more densely populated area, you may have multiple
Yeah.
choices and want to explore those a bit.
Mhm.
Um, so information from marketers, there's a lot of educational information we put out there for our clients, information sessions, information on your website, whether it's your own content. Many of you subscribe to third-party sources for self-diagnosis and putting information out there that's been vetted. But advertising, public relations, physician relations, all of that helps to form patients' opinions about how to make ultimately their decision. And then moving closer to our sort of subject today, online reviews, information from other people. Physicians certainly play a key role, especially for different demographics, and we'll talk about that next. Friends and family are often solicited, especially for certain demographics. We'll talk about that next. But then crowdsourcing. We often see that ourselves. Facebook even has a feature. Hey, folks, Paul's looking for a recommendation
Mhm.
for something. And whether that takes the form of a direct outreach, a direct solicitation to your offline or online networks, or again, people go to review sites for their utility and the ease of being able to solicit multiple reviews. The review platform has already collected it for me and saves me the trouble of going to collect it from myself, essentially.
Yeah, I was just going to mention like it's more than just reviews that we're talking about because like going into the crowdsourcing, I know when I was trying to pick my primary care, before I even went and looked at reviews, the first thing I did was ask Facebook, hey, does anyone have recommendations? Because people are going to trust recommendations from people they know, from their friends, their family members, before they'll trust random reviews. Random reviews are still very important because they want to be validated that, yes, this is a good place to go. Other people had good experiences. But I think the first layer is usually the crowdsourcing, asking people you know. So that's why you want to make sure your existing patients are going to talk positively about you and recommend you.
Yeah, that's spot on. I think trusting the people that you know and trust, and then looking to perhaps quantify that. I may have
Mm.
two family members that I know or friends that I know and respect their opinions, but I also want to hear from 50 other people. And what is that aggregate 3-star,
Hmm.
5-star
Hmm.
rating? Um, I have a particular family member. This is being recorded. Doubt that she's watching, so I won't name names, but that basically shop around for the opinion and the point of view that they actually want to hear. So I
Mm.
will ask people what they think until I get the answer that I actually want. And in some cases, that bias happens
Mm.
on review platforms as well. So online reviews. Let's get to that, the heart of what we were talking. I think it was important to bring this up to this point, but then ask ourselves, does it really matter? And what are the options? Well, there's a ton of them. For healthcare in particular, that list gets a little bit shorter, but I think we're familiar with the earliest ones like Angie's List, at least for all types of consumer reviews, rather. Um, and now what we're finding, this top row seems to be the sort of top three that we've been paying the most attention to and dedicating our resources to. Google My Business reviews are extremely prolific. If nothing else, you can't miss them. Um, Facebook, gathers information where the people are gathering. It's still the 800-pound gorilla. Love it, hate it. There's other platforms that are relevant, but that seems to be the biggest and still most dominant. And then Yelp, which we'll talk about in a little bit more detail in a moment. Now, this bottom row is interesting because these are opportunities for and places for consumers to go for hospital-specific information and even reviews. They may look at this data and say, here's the particular safety grade, here's the rankings, and it takes a particular type of patient to go and search that information and then also look for some of the comments that may or may not appear on their platforms. The other opportunity for this is for the hospitals and health systems themselves. So if you were a hospital recently awarded a top 100 nationwide by Health Grades, that's fabulous. you may not have consumers that would go and look for that information on HealthGrade's site, but you have an opportunity to go tell people about that on the basis of this quality. Now we're getting sort of out of online reviews into rankings, but I think it's important because it's a very similar information that helps form decisions. Where it's a little bit different is this is we would be talking in that case about the comments that would appear on your social media platform when you go out and say, hey, we're excited to announce we're top 100. What happens below that can help either validate or question those claims from the point of view of your patients and your community. So with that in mind, there's a lot of platforms. These seem to be, at least in particular, this top row is what we'll talk about. These are the places consumers are used to going for a lot of other information in their lives. And they're wondering if they can also, to Katie's point, learn about, healthcare options as well. So is it possible to go onto Yelp and find online reviews for your hospital? Well, the answer is yeah, the whole hospital. Adam, let's roll that first video.
A hospital for your surgery or a retirement home for your loved ones are important decisions, but they're not easy to make. So ABC Action News reporter Lauren Rosella is taking action for you tonight, explaining how Yelp can now help you decide.
Yelp says they're adding this to help consumers make better decisions in very critical times, but advocates warn you need to do more research. There's so many factors to consider in picking a care facility or hospital, like quality, cleanliness, the staff, even the food. Now, consumer review website Yelp is aiming to make that easier.
We give just another layer of information that can help guide their really important offline decision.
Yelp is now using state inspection reports from Medicare.gov to rank these medical facilities.
If you can take this information and put it into a context that makes more sense while they're in the middle of making that decision, then it's a win-win for consumer.
So the interesting thing, and I think probably the most important thing about that, is Yelp's data is coming from third-party sources, in this case, Medicare data. There are opportunities, I think, for consumers to be able to trust that information, especially if they're familiar with or they understand that Yelp is helping to aggregate that. The Yelp platform itself, though, also offers an opportunity for consumers to chime in, and that's what we'll talk about in a moment. So that's at the hospital level. There is third-party data that Yelp can aggregate for us and help tell us about, particular ratings or reviews. But what about a specific department? Adam, let's roll that next video.
Expectant moms can now add Yelp to their birthing plan to get important information on their hospital. Soon-to-be moms are turning to the popular review site to get information on the maternity care where they plan to deliver.
CBS 13's Elisa Becerra is live now at UC Davis Medical Center getting answers on what inspired this new feature. Elisa?
Yeah, well, really a need for information. And in fact, UC Davis, you can Yelp it and see how they're doing. This is a new way for consumers to really see how their hospital is doing and where it comes to maternity care, but not just patient reviews, but they can also get some real hard data.
When you think of Yelp, you think of...
I just think of food and just businesses.
But now expectant moms in California can go to Yelp and check on hospital rates concerning C-sections, including the percentage of C-section deliveries in low-risk pregnancies to mothers having their first baby, breastfeeding rates, the percentage of newborns fed only breast milk before being discharged from the hospital, or if vaginal births are available after C-section.
So again, all of that data-driven from third-party sources, and all of that can start to rank and rate and help form opinions about the things that might matter to you, whether it's important about breastfeeding or if it's a second child and you're looking at VBAC rates. All of that can be aggregated and is being aggregated by Yelp. I think it was smart for them to step into that space. They understand that consumers are trying to make decisions. I think in that last clip to the one woman saying, I think about it for restaurant reviews, but I didn't necessarily think about it for this type of this type of setting for healthcare and hospitals. Raises an interesting question, and again, love to know opinions. Throw your thoughts in the chat. Is Yelp a credible platform? Do consumers understand that there is objective data behind that, at least for starters? But then, as you might have seen on the screen, there is an opportunity for the public to comment. Yeah, that might be what the data says, but I saw something similar, different, whatever else. And I think that's what gets to the heart of these online reviews, is that aggregate of the community or patients' perceptions. So does it really matter? We're talking about, Yelp as one example, and in particular Yelp for even a specific service line. But are these all things to all people? Not all my patients and the people that walk through our doors or are carried through our doors every day would look at this the same way. So in the second chapter of our book, we talk about a lot of those generational differences and break it down by those different age categories and really what the drivers are for that. And I think it's important to walk through that pretty quickly. So again, the level of consumer empowerment, I think also matters. We'll talk about that first before we get into the generational differences that also drive these opinions. So as a real treat, and I know that there's somebody in the audience that heard us speak at the Healthcare Association of New York State's annual meeting in 2004. So let's take a trip down memory lane and talk about consumer empowerment. Now, online reviews may or may not matter to folks based on where they fall in this spectrum. So at that time, we had this range of patients that we would start to put into different categories. And at one end of the spectrum were the Murphy Browns. Katie, familiar with Murphy Brown?
Just found out what that is today.
before our webinar, we were talking about who is this Murphy Brown? And many of you may not recognize it. It may not necessarily even be relevant today. Murphy Brown was a pretty iconic character, star of the Murphy Brown Show. I think that was the name of it anyway, but her character was very strong-willed. And in particular, this one instance was her character was going to have a baby. She was going to be doing it out of wedlock, and it was going to be the way that she wanted it to be. She was very strong-willed. She was very empowered. She took control over her health care. And in fact, I believe her character was even debating at the time with Vice President, I think it was even Dan Quayle during that administration. And so there was even a public thing about this empowered patient, taking control. So that's at one end of the extreme. The just fix me's on the other end of the extreme, these patients, they come in and just say, look, you've got the diploma, you got the white lab coat, whatever, here's my symptoms. You tell me what to do, I'll follow your lead. So online reviews will matter differently depending on where folks fall on that spectrum. The Murphy Browns may be looking at things like health grades. They may even be searching out health grades. They may appreciate your claims about your ranking on health grades. The Just Fix Me's, if they even pay attention to online reviews, would be in more consumer platforms. But in this case, in this particular Just Fix Me on screen, maybe not at all. So breaking down those generational differences, I think, is also important to know who those who's going to be looking at and necessarily influenced by online reviews. And so in our book, we break down these different generations into the greatest and silent generation, baby boomers, Gen X, millennials, Gen Z. So that greatest generation, the oldest, tribal elders of our society, mostly are being influenced by physician referrals. Wherever my doctor says I should go is where I'm going to go. And in particular, it's going to be based on proximity and convenience. And many of them already have a habit. They've been getting healthcare services throughout different stages of their lives, or even as they age, having a different and more frequent set of needs. So they're used to going to that place. They're least likely to be researching things on their own, and having a very low or no digital platform, and therefore no opportunity for those online reviews to influence their decisions. A little bit younger, the baby boomers. I'm just missing this one, Katie, by 3 years. Still influenced by physician referrals and proximity. Likely to be influenced by traditional media, word of mouth offline, a little more likely than their other generations above them to do research. I wouldn't say that they have necessarily a no digital presence, especially when you get on those younger boomers. They're more active on social media. They've been, engaging in it since the earliest days, but they grew up on traditional offline media. So they live in that space in between. Some influence on them by online reviews and social media and the opinions of others, though much of it may come from offline reviews or physician referrals. All right, Gen X, yours truly. little bit about physician referrals. Again, we grew up offline and matured online, but we will do a lot of active research. We would look at an integrated mix of online and digital word of mouth and reviews. We saw the transformation to become empowered shoppers, at least healthcare consumers. A lot of that was broken down by WebMD in the late 90s, when those barriers were broken. I can couldn't Google in the late 90s. I could type in my symptoms and I could bring those into my physician. And, at the time, my physician, he or she may or may not have been receptive to that. But we learned how that could change from offline to online. And we're also somewhat mobile in terms of our desire to move around, less likely to make decisions necessarily based on proximity. And again, that would depend on the type of service line as well. So millennials, Katie reminds me, these folks are now in their, coming up on 40. They have families and children of their own. So they're really in that, spot, and very highly desired, I think, by us as marketers and hospitals and health systems. I know a lot of what we launch for our clients, and Katie in particular launches a lot of these campaigns. Those young families, if you can lock them in during their OBGYN and their labor and delivery procedures, and if their experience is positive and they don't move out of your market, you've got a family, for life. You'll work with them throughout their journey, and help to provide those services. Strong online, but very strong offline, strong offline, but very strong online social networks. They're empowered. They're very mobile. They're very likely to move and go where they could go, but they're also very likely to, or less loyal, and very likely or more susceptible to switching, and very likely to crowdsource and search for online reviews themselves.
I just wanted to mention when we were talking about maternity, that's huge for millennials because they are empowered and they want whatever experience they want. That's what they want, and they'll go wherever they want to go to get it. So yeah, like Paul was saying, if you can give them that good experience, then they'll stay with you. But if it doesn't live up to their expectations with something as personal and important as maternity, they're gone.
Yeah, and those opinions are shaped in a lot of other areas of their consumerism. They're used to drive-through experiences. They're used to one-click purchases. Anything, the most obscure possible product better be on my doorstep within 2 days. And I think that carries with them. And that's the content that they're looking for. And I think it's important to mention this as part of our conversation today. The information and content that all of these generations are going to be looking for, if they do connect with reviews, will vary. To Katie's point, this group will say, I want to know that there's good bedside manner, that you're going to partner with me and learn about what matters to me as a patient, and that together we're going to take this journey, and you're going to respect my wishes, and I'll respect your education, your perspective, your technology as a healthcare provider. But if I can't get a timely access to services, if I feel like I'm a number, not a patient, this group in particular is more likely to move on based on those factors that they'll read on reviews. Gen Z, the youngest, very strong online social networks. They'll know no difference in their lives than, a life on a 4-inch screen. But at these ages are typically following the guidance of their parents. And maybe for the oldest parts of this Gen Z crowd, they will go from having the primary care physician pediatrician rather, that I had, which might have stayed with me through college. But in this oldest age, they're starting to get their own primary care physician. They're stepping out of their parents' shadow, and in some cases quite literally as they move away from home. And build up their own lives. And so they're coming into that early stage, and in which case they would follow the behaviors of the ones before them that we were talking about, the millennials. So in this last portion of our webinar today, let's talk about managing reviews and what are those different tips. Again, it'll vary based on the different types of platforms, but let's stay on that top portion as well. So we want patients to leave reviews. That helps, not only technically with all the Google algorithms and all the other things that could help us, bubble up to the top compared to another organization that might be in our market. But obviously, part of the reason we're talking about this is not all reviews are positive or constructive. So let's walk through some of those tips on how you can manage and handle either negative reviews or just, that platform overall. So Katie and I will take you through this section here. First, I think it's extremely important to be vigilant. Having somebody that is clearly assigned and specifically part of their job, not just, hey, keep an eye out on Yelp or Facebook or our Google reviews, but specifically, do me a favor, twice a month, every Monday morning when you're kind of just settling in for the day, before you check your email, could you check our reviews? Make that a part of not only a specific person's job, but also a specific timeline. Could you also then give me a quick summary? Do we have more reviews, less reviews, positive, neutral, negative? At the very least, be checking it with that type of frequency. And I know some of us have larger marketing departments than others. We may have more resources. You could devote to this a couple times a week, sign up for alerts, whatever else it is. So the second bullet, stay calm, pause. Very often, and we say this a lot, I think many of you that watch this webinar series have heard us talk about this on social media. You don't have to be necessarily the first voice that replies on your behalf, but very often the community is ready to jump in. If somebody has a negative experience, we'll tell our clients, depending on obviously what the nature of it is, but in general, pause for a second, see what others might want to jump in and say. Hopefully they'll disagree and say, no, I've had a much better experience. You must have caught them on a bad day or, something else. But, in general, your community wants to give you the benefit of the doubt. You're on the side of angels, and I think I'm getting ahead of myself on that slide at that point. While it's important to pay attention to all reviews, watch the trends. Don't get wrapped up in the individual reviews. It's really tempting to just get excited about something, especially if it's inflammatory, and you should respond appropriately. But in general, look at those trends. Are you going from a 3 to a 4 to a 5-star rating over time? Is it constantly moving upward? Is it steady? Those are the things that you want to pay attention to and be able to influence change. Now, how do you do that? Sharing those reviews with the internal teams. As marketers, we're constantly wondering what's being said about us and what we're saying to the public about ourselves. But none of that will affect change unless you bring that into those department meetings. When you get at the president's cabinet or whatever you call it, as part of your monthly, quarterly updates, whatever, that's the opportunity, I think, to share those trends. Hey, as I'm looking at our reviews on Yelp or on Google, we tend to be scoring a 3 out of 5, 4 out of 5. And as I dive deeper, those keywords that are popping up most often are related to what? Quality outcomes, customer service, et cetera. But sharing that with, your chief quality officer, sharing that with your operations team, all of those other things. This is where you've heard us say before about the airline tray table analogy. If I'm flying and I'm, cruising at 30,000 feet, midway through my flight, and it's time for a snack, I flip the tray down in front of me, and if that's a mess, that's sort of, it's not going to ruin my whole experience, but it's going to make me question, if you guys can't handle something as simple as a tray table, how are you doing with those engines out the window? And so those are the things that pop up, and those are the things that end up on the reviews. It's messy, it's dirty, it's disgusting, it's whatever it is. Again, more so than technology and the best doctors. I don't see that happening as much. They don't have enough Yale graduates. I wish I saw more people from Johns Hopkins. And they're don't even get me started about their MRI. It's 1.5 years old. That doesn't pop up on reviews. It's typically those customer service aspects and the way that you're going to affect the change. And your responsibility, frankly, as marketers, is to share that with the internal teams. Acknowledging the negative reviews. I think Katie and I were talking before the webinar, and she hates to, and I believe everybody feels the same way, see the dead air, right, Katie?
Yeah. So I've looked at many hospital reviews in my times with Smith & Jones, and it's always interesting to see, say if there's 20 Google reviews, no replies at all on positive or negative. And to me, it's always better to reply, even if it's a canned response, even if you're replying to something negative and saying, hey, we're going to send you an email, we're going to follow up with you. Just seeing that their concerns are being acknowledged, that you're being listened to, is better than just nothing, in my opinion, because me, an outsider looking at it, how are they responding to whether positive or negative? Are they listening, or do they just not care? So to me, I always prefer to see when organizations reply to everything.
Goes back to our golden rule, never say no comment. And in every case, wherever possible, a timely reply, I think, is in order, especially if it's something negative. Somebody may complain about something that either is or isn't justifiable, but the rest of the community wants to see that you've responded, even if you're not going to, and we don't recommend that you get into it necessarily right there on that platform. But if a reviewer, Bob XYZ, says, I absolutely hate it, the community really appreciates when the hospital says, hey, Bob XYZ, could we take this conversation offline? I would like to learn a little bit more about your experience. Sounds like your experience was really different than we hope for all of our patients. And I want to learn more about that. And in particular, I want to share those thoughts with our leadership team. Would you mind emailing me, direct message me, at this? How you handle a situation, and if you were in our last webinar on crisis PR, how you handle that situation is often reflects better on the organization than the negative initial response.
So I got an interesting question in the chat. What do you do when your own employees are doing the bashing?
That is, I'm going to put my clicker down for a moment. Great question. And loaded depending on your institution. I'll look up the person asking about this in a bit. There's a couple things that you can do, I think, in a situation like that. Well, first, are you a non-union or a union shop? That may make all the difference at first. We always believe, and you've heard us say this, employees are the foot soldiers of the brand. There's an appropriate time and place and platform to share that. If your goal is to help our organization improve so that we can all advance our careers and do great work for the community, which is why we're here, is an online review, perhaps that platform for that. Now, many organizations have or should have a set of social media guidelines for usage and how that can be used. And we'd be happy to share this with anybody. Just drop a note in the chat and we'd be happy to send you a sample of that social media guidelines. Letting folks know their voice carries a lot of weight. Especially to Katie's point about rural communities where it's neighbors taking care of neighbors, and I see all my patients while I'm in line at the grocery store. It can have a very impactful, damaging impact, or positive or negative, with your organization. If it's especially attributed, hey, I'm an ICU nurse and we do horrible work here. I think it's perfectly fine, especially if you have if you have a social media code in place, to be able to bring this person offline to say, hey, Susie, would love to know what you're thinking about. What's on your mind here? Would love for you to, share these thoughts with us and have a direct dialogue with us where you could actually affect change. We're not going to tell you you can't, exercise your right to free speech or whatever, but you have to understand that your voice carries weight. And perhaps that's why you did it. Maybe you were very keenly aware of that and you wanted to be able to go out to the public and say, my voice carries weight and I'm pretty pissed off about this. And so I want to tell everybody how pissed off I am about it, because whatever the negative situation is. But letting them know that ultimately, that hurts their colleagues, that hurts the hospital's reputation. It certainly isn't the direct dialogue to make that change. But letting them know that their voice is being heard indirectly gives them a little bit of a, we heard you, and reminds them that this is the appropriate platform to do that. And so with that in mind, to the second to last bullet here, you could ask the reviewer to delete the post when the issue's been resolved. You can always ask. And in a lot of cases, we've seen people say, yeah, thanks. I went here to gripe. You heard me, the situation was resolved. You were able to make good and make me whole, whatever the thing might be, where the problem might be. So yeah, I'll take down the review. Sure, why not? But again, happy to share that, the set of social media guidelines. Very often we've seen those change over time. Hospitals would say, I'm going to prohibit employees from going on certain websites and domains. You can't use the hospital's internet to get onto Facebook. All that behavior goes underground. I'll just use this device at my desk. Thank you. So you'll never restrict it. You certainly don't want to censor it. You'll never prevent it wholly. But I think calling somebody out in a constructive manner to say, hey, you're going to be more successful if we have a direct conversation than an indirect conversation about it.
Yeah, that them going online kind of sounds like a red flag. So maybe making sure that you do have anonymous ways to submit. Just make sure you're being very open with, hey, if anyone has any issues, here's who you go to, here's when, have an inbox, like whatever it is, just to make sure that there is a way for them to voice their concerns internally first before going on to social media.
Yeah, and even starting that conversation with the employee, like, hey, I saw your review. I didn't know if you meant that to be anonymous or not, but it kind of came through that it was you. Jeez. But that said, let's have a direct conversation. Tell me more about this situation. I want to be able to learn. I want to be able to take your thoughts up the chain to leadership, maybe blend it with others, the opinions of others, and start to build a theme and a dialogue. And can I report back to you after we've had those conversations, if it's valid? Sometimes people just like to complain, right, Katie?
I mean, and healthcare is so emotional and so heated and intense, so it's really hard with the negative reviews.
Yeah, especially the last couple of years. Healthcare, all of you have never been under more strain in terms of the workload, smaller staffs, the pressure and strain that we were under from COVID and everything beyond. Certainly use this as a teaching moment. I'm channeling my parenting skills here as well, but use this as a teaching moment and a chance to, second bullet, stay calm, pause, and use it as an opportunity to listen and learn from your employees. And, again, even responding, telling that to Katie's point, let the people on that review platform know that, hey, RN nurse in the ICU, thanks for sharing that. I'll bring this back as part of our internal conversations, because your opinion is more direct than those maybe of our patients. So thanks for sharing. We'll deal with that, inside, and we'll let you know what we learned or find out. And then the last point here, authenticate the reviews. There may be things that are completely inappropriate. The reviewer may be a bot. A lot of these things pop up for a number of different reasons. And so with that in mind, can it be reviewed, or can a bad review be removed, rather? Yes, especially if it violates the guidelines of those platforms. If it's threatening, offensive, illegal, violates, if it's not HIPAA-rific, if it impersonates something else. Google, for instance, and all the platforms make it very easy for you as an admin of your Facebook or your Google My Business, or even being able to go in. Yelp would love for you to have a Yelp account, and also pay Yelp to promote your brand online. But you would simply, in this case, go through, look at the reviews that you have, go look at the reviewer, in this case, the 1-star rating, click through to report the review, and it's actually not relevant to this place. They got the wrong name of a different company, and it goes away. Screenshot this if you'd like, but again, happy to send you this deck and anything else after the webinar. But we also use this not only for social media, but also online reviews and comments. This sort of communication tree. Assess the message. Do you want to respond? Can your response add value? What's the purpose of it? In this case, and going back to the question that came in from the chat about the employee. All right, so what was the purpose of this message? Is it an unhappy stakeholder? Are the facts correct? Or are they a dedicated complainer, comedian wannabe? Following this guide through, and we don't have time to necessarily get into all the different steps, but I think this can also be a helpful tool. Print it out, tack it up on the bulletin board in your office, and help it guide you through, especially the tougher situations and settings. And again, to that second bullet point, stay calm, channeling the wisdom of my father. Nobody ever want to fight on Facebook, and that's absolutely true. So what are some of the other extremes that could be taken? We wouldn't necessarily advocate for all of those, but Adam, let's roll this next video.
Tonight, a lesson perhaps for anyone who posts their own reviews on the internet.
Yeah, a doctor in Manhattan successfully sued the review site Yelp and then successfully sued some of his patients who skewered him in their reviews.
Really skewered him, criticized him for things he says were not true. Be careful what you write. Here's Eyewitness News reporter Mike Marsa.
One reviewer posted, "I just can't believe this is even legal the way he operates. Never ever go to this horrible dungeon services." Others accuse the doctor of using bogus Botox.
If somebody is writing that my Botox is coming out of China, then that is defamation.
So Dr. Mohammed Mirza sued the review site Yelp.
They weren't sued for liability purposes. They were sued to reveal the names of these reviewers.
He won.
It's easy to write a review because you are hiding behind the screen.
And then sued a dozen reviewers for what he argues are false claims.
It's a very growing trend because you have to realize the businesses are under attack. They're under attack by negative reviews. It could ruin their entire business.
One reviewer posting, "And to Dr. Mirza, come sue me, LOL. You're a joke. I'm within my legal ground, and my father is one of the best rated attorneys in New York. The only one who should be sued is you for malpractice." Dr. Mirza says he's already won or reached settlements with 3 reviewers, forcing them to take down the false reviews and pay an undisclosed amount of money.
My point is, if somebody is writing claims out of thin air, then we need to go after them.
The doctor says the legal fight has cost him more than $100,000 in legal fees.
30 years building a reputation, and now you have this campaign to destroy this business.
The rulings also prohibit the reviewers from talking about Dr. Mirza and his practice publicly, but he hopes it's a lesson.
Most of the people don't understand the ramifications of their review if you go in a court of law.
Mike Marza, Channel 7 Eyewitness News.
So, yeah, I'm glad he did it and we didn't have to. I don't know that I would recommend this approach to most of our clients in most circumstances. I think the core message here is certainly to the people that hopefully see a story like this, I don't have that anonymity. There could be consequences for my posting, and I should be a little bit more appropriate and understand that that I can't necessarily hide behind whatever I choose to want to say. But I think the core message here is, and in this one physician's case in particular, going back to that communication tree here, let me just do that. I'll go back here. So assessing that message on the review, what's the evaluation of the purpose? They seem to be pretty mean-spirited, but are the facts correct? No, they're not. So let's gently correct the facts. I believe you should take the high ground. I believe your brand should transcend mudslinging. I don't know within the most limited circumstances that you should publicly announce that you're suing your patients or even sue them to begin with. But I do believe that there's an opportunity within that high ground on that platform to say, hey, so-and-so, just want to make sure that you're aware that, unfortunately you don't have the facts correct. I purchased my Botox from wherever it is. Maybe the brands coming out of China or domestic might just be fine, but I want people to know that, and everything is certified by the FDA and everything else. I would appreciate it if you would delete this comment because it's inaccurate. Again, to Katie's point, that response, that public response, is more important, and then let it stand. You don't want to engage in, all right, now they followed up and I've got another point of view and another thought, et cetera, et cetera.
Yeah, and even if they don't take it down, at least people can see that you did respond to it and corrected the facts.
Yeah. Now, as for the liabilities and the obligations that these platforms have, that's a battle I think that should be, if it needs to be fought, between Yelp and Google reviews and Facebook and American Hospital Association, your state hospital association. I don't know that you would want to get into that as an individual institution, but rather rally, this is the role associations can have for advocacy on everything from legislative issues to changing policies on review sites. That's where that fight should happen. I don't believe the public wants to see you mudslinging, in this. But there's a side of me that, I'm glad he did it. I hope people saw it, and I hope it changes behavior for people to, know that there's less anonymity and more consequences potentially. So,
another question came in. How do you manage internal concerns about receiving public reviews that are lower than a 5 or include negative comments? So your employees are seeing, why did this patient leave a bad review?
Yeah, I think so. The question there, I think, gets to, how do I communicate this internally? If I only have a 3.5-star rating, how do I tell, what do I say, and how do I manage the internal reactions to that? The data on a review platform will never be as robust as your institutional data. What your success rates are, what the other rates are. I think letting people know that while we might rate 3.5 over here on Google from 10 reviews, we had 800 deliveries last year, and look at the success rate, look at these other types of rates and policies and everything else. So I think that that's really important to understand as we, as you go through, educating people that this is a limited sampling online versus, what those institutional, those internal realities to be. So with that, I think we just have a couple parting thoughts, which I can't remember because it's not on the screen. There it is. There they are. You're on the side of angels. Take the high road, to our last video clip example. Your community, the public, wants to see you succeed. They appreciate, they value the role that you play in the market and what you do. Not every experience is going to be positive. There will be loud voices online. Watch the trends in particular, not necessarily drive yourself crazy on any individual response. Pause, wait, be calm. Let's see if the public jumps in to save us, or if we need, and should respond. Again, taking the high road, take the conversation offline, and let people know that would be reading those comments as deeply that that you care. And of course, be open and honest. Trust is the bedrock of your brand. Obviously, that's the point of that last video. Was this particular physician was worried that the public wouldn't trust him based on inferior products or procedures, whatever else those quality claims were. So you certainly want to protect that. But being truthful, and you've heard us say this before, even on the public relations and the crisis webinar we did last month, just building that trust, speaking openly and honestly, and letting folks know that their voices have been heard is more often than not enough to satisfy the situation itself. So thank you for joining us. On behalf of myself and Katie, thanks for tuning in live. For those of you on Zoom, we caught some chats and questions. For those of you that are watching this on our social media platforms, we'll look at your comments and try to reply offline on those as well. And if you're watching this on demand in the future, drop us a note as well. And again, as promised, we have copies of our second edition, Under the Influence, that'll be going out to folks that haven't already received one that registered for today's webinar, and be happy to share the slide deck and some of those charts and diagrams that are embedded within. So,
and Kevin, we will follow up with you on your final question. But thank you, everyone, for dropping in your questions and participating. So this has been great.
Thank you very much.
Thank you. Have a good one.